So I don't have a lot of fun videos like Dr. Scott, but I'll do my best to keep everyone entertained and engaged. So sleep is a very important pillar, just like mentioned earlier, to our well-being, and it's very important piece. I say, about food, sometimes we can fast from food, and then sometimes it's healthy, but it's never healthy to fast from sleep. So we're going to talk a little bit about what makes healthy sleep, and I think of it as typically three components. It's quantity, quality, and timing. And timing is really important. So those are the main pillars. And a lot of times the most common question I get is about quantity. So we're going to talk about what's healthy sleep and what's a good quantity sleep. Oftentimes people ask me, am I getting enough sleep? And the question is, try to ask it differently, is are you sleep deprived? So if you are usually waking up with an alarm. How many people here wake up with an alarm in the morning? Okay. So you're artificially waking yourself up, right? So you're not waking up on your own. So that's a sign. How many people here sleep in on the weekends? Okay, not many. Maybe you should. Maybe more people should do that. So if you're sleeping in on the weekend for an hour or longer, you're probably not getting enough sleep. So if we go back to, we're looking at this slide here, which is the National Sleep Foundation comes out with recommendations every year, and through every stage of life, we are expected to sleep a certain amount. When the younger we are, obviously, the more we need sleep. Most common thing we hear about is 8 hours. So for adults, 8 hours is an average, which means that some people will need less, some people will need more. For teenagers, it's closer to 9. As we get older, and this is a thinking, we used to think that as we get older, actually, our sleep is supposed to worsen, and that's not true. As we get older, maybe we sleep less, a lot less than we used to think. So if you're older and you're sleeping an hour less, it could be a problem. 15, 20 minutes, usually that can be within the normal range. After age of 60, more likely 70 or 80. However, we are supposed to have healthy sleep throughout every stage of our life. So next slide, thank you. So this is the breakdown of, this is kind of a busy slide, but we talk about different stages. So sleep latency is how long it takes us to fall asleep. So typically if it's taking us 15 to 20 minutes to fall asleep, that's perfectly normal. WASO stands for wake after sleep onset, and you see that number grows over time. So it's perfectly normal we expect to sleep through the night, and that's typically expected under age 40. After age 40, we start sleeping sometimes in 2 stretches. So it's not abnormal to wake up once in the middle of the night and fall back asleep. As we get into our 70s and 80s, that number can go from once to twice.
Got a clicker.
Okay, great. So, so then what we can do is think about, once we start waking up more often, we're talking about 2 to 3 times, especially if we have trouble falling back asleep, then that's when we might have a problem. And we should consider help. See if this is okay. So what is a normal sleep cycle? So sleep as a stretch. So if you're sleeping 8 hours, it's not all the same. So you probably have heard about REM sleep and deep sleep. So until the EEG was invented, which is an electroencephalogram, we used to think, okay, well, just you're asleep or you're awake. And now we learn that there are different stages of sleep. So there's this is kind of like a perfect cycle. Almost no one has this cycle. But typically, if we're getting close to that, that's pretty good. So you start at the top as wake, then stage 1 is very light sleep. It usually takes about 5% of the night. This is the stage of if you notice someone next to you nodding off, and they'll say, well, no, I wasn't really asleep. I was just resting my eyes or watching my eyelids, however you want to call that. So that's supposed to be 5% of the night, and that's really light sleep, and it's there for a reason. It's a transition from wakefulness to sleep state. Then we have stage 2, which is a bigger chunk of the night, usually takes about 45 minutes. Then we're really asleep. It's still considered light sleep, but it's just as important. And then the next step is deep sleep, which is the quietest your mind or body is. So basically your mind is on standby, your heart rate slows down, your blood pressure lowers, hopefully. And that's typically quite restful. And then the next stage of sleep is REM sleep, and REM sleep stands for rapid eye movements. And typically it's called this because most of your skeletal muscles, the muscles that help you move around, become atonic, paralyzed, basically. And what that means is that if you're having a dream of running or punching or grabbing something, you actually don't act that in real life. And there are exceptions. your eye muscles, that's why it's called rapid eye movement, one of your inner ear muscles, so you can still hear if there's something, and your diaphragm. We heard about the diaphragm laughing. So diaphragm is our major muscle of respiration. That's another reason to keep that muscle healthy, because we really rely on it, especially when we go into REM sleep. And REM sleep is very important for emotional processing, for learning. Your brain actually during REM sleep is almost just as active as when you're awake. So your heart rate also can vary, blood pressure can vary during this stage. And then we wake up. So we could have a micro awakening typically after each cycle. And each cycle is usually 90 minutes to 2 hours. So we go from stage 1, stage 2, deep sleep, REM, and the cycle repeats. As you can probably notice here, the first half of the night, we tend to have more deep sleep. The second half of the night, we have more REM. On average, about half the time we wake up from REM. So you probably notice when you wake up, you actually wake up from a dream about half the times. We typically always have dreams, we just don't always remember them unless we wake up from that dream. So this is just a kind of a busy slide to say that every single system in our body is impacted by sleep. Whether it's our emotional well-being, whether it's our cardiovascular health, which is why we're here, whether it's our hormones in general, from testosterone to various hormones, get really impacted. So one night of poor sleep can drop men's testosterone by as much as 15 to 20%. It's really important. Cardiac health, long-term sleep deprivation is a risk factor for cardiovascular disease. And then we'll talk a little bit here about also sleep apnea. So what regulates sleep? What creates a normal, healthy sleep-wake cycle? And there are two major factors. One is something we call the homeostatic sleep drive, which is a big word basically for saying sleep hunger. And sleep hunger is like food hunger, like I mentioned earlier when you're fasting, except it's a lot stronger. So you can fast from food, and maybe you feel a little headache, you feel a little tired, and then usually you can overcome that, but you can't really fast from sleep. Eventually you'll have sleep creep up on you. It's just like what we call microsleep. This is why people sometimes fall asleep on the 101. No one wants to do that, but they can't help it. This is why sleep deprivation is a form of torture, because we really have this very strong drive to help us get the amount of sleep we need. And then another factor is our circadian rhythm. It's our 24-hour clock that helps us adjust to the local times. What happens when you're jet lagged and you get this sort of sleep-wake cycle, and you can be more alert certain times of the day and you can be more sleepy other times of the day. So when you have a normal 24-hour cycle, you basically wake up in the morning, hopefully refreshed. You haven't built up any sleep hunger from the day before. You start with a clean slate. And throughout the day, your sleep hunger starts building up. And the reason you don't fall asleep in the middle of the day is because your alerting signals from the circadian rhythm push more energy and alertness, so you stay awake. In the afternoon, we have a natural dip, usually between 2 to 5 p.m. And in the evening, we all get a second wind. And if you're a morning person, typically your second wind would be earlier. If you're a night person, or you consider yourself a night person, your second wind would start later and last a little bit longer. And then you reach a certain tipping point, typically around your natural bedtime, where that sleep hunger is really building up, the alerting signals from the circadian rhythm go away, and then there's a natural shift from being awake to fall asleep. And sleepiness is a really passive process. You really can't force yourself to fall asleep. This is why we develop insomnia, and I'll talk about this next. But typically the idea is we let ourselves go and fall into sleep. So this is another, people talked a lot about melatonin. So we do have a circadian rhythm. Our melatonin levels changes in our body. Basically every hormone in our body can be impacted by our circadian rhythm. So we're going to talk about a couple big problems that happen, most common problems. One is insomnia, and the other one we'll talk a little bit briefly about apnea. So what is insomnia? So I think of insomnia kind of needs three factors. It starts out with a predisposition. Some of us are unlucky enough to have this predisposition of if we go through grief, we go through stressor, sometimes even something positive we're really excited about, we tend to have a bit of an hypervigilant state. This kind of propensity for us to be more alert, more engaged. And sometimes that helps us and serve well in other aspects of our life, and when it comes to sleep, it's not ideal. It can really predispose us to this next thing, which is a precipitating factor. So we can have a predisposition, and we have a precipitating factor, which usually means that we've gone through a stressor. And like I mentioned, it could be anything go through life. It could be medical condition. It could be change with job loss, etc., any form of grief. And then what takes insomnia from being a short-term problem, usually 1 to 2 months or so, to being a long-term problem are often perpetuating factors. Things we do that we're thinking we're helping ourselves, but oftentimes then backfire. The most common mistake people fall into is say, well, it takes me an hour to fall asleep, it's taking me longer, so I better go to bed early and spend more time in bed. And that's usually not helpful, because then we start thinking about the bed as a place where we toss and turn and we struggle, and we have that association that over time drives our hypervigilance and makes the insomnia worse. The other topic is obstructive sleep apnea, which is a very common condition. There's an interesting study done at the Mayo Clinic. It looked at patients waiting in the cardiologist waiting room. We're talking about the heart forum. So 1 out of 3 patients waiting in the cardiologist room had some sleep apnea. So it's very prevalent. So patients who, for example, have atrial fibrillation, which is an irregular heartbeat, tend to have about as much as half of them have obstructive sleep apnea. Sometimes if people have hypertension, that's very hard to treat, meaning that you're taking 2 or more blood pressure pills, apnea can be part of the problem. And treating this apnea will help improve your blood pressure and also improve your irregular heartbeat if you have atrial fibrillation. So these are the 2 common conditions that we see: very severe high blood pressure and atrial fibrillation. So what happens when we have this slowing? What apnea is a reduction in airflow. So you have a full open airway, and now all of a sudden you have a reduction in airflow. So your nervous system reacts as if you're choking or you're not getting enough air. So it sends these signals down to the rest of the nervous system to get activated. And all of this potentially leads to weakening your heart muscle over time, reducing your airflow to your brain, which then over time can increase your risk of other things like dementia and cardiovascular disease like heart attacks and stroke. So the way the body does this by trying to send more oxygen to the brain, by sending more nutrition to the brain, it raises the blood pressure, increases your heart rate. And over time, that conditioning is not very helpful. So in that conditioning over time leads to high blood pressure, worsening insulin resistance, which then leads to diabetes. So it's really important if someone snores, especially if you snore loudly, because people ask me, well, how do I know if I have sleep apnea? I don't gasp for air. My partner doesn't always hear me snore. So the common things, we use the STOP questionnaire. Actually, we were one of the early hospitals to adopt it. We had JCO come in, and actually they were very impressed with it. They've used it as a model for other hospitals. So we do the STOP questionnaire, which means we ask about snoring, and if snoring is louder than talking. T is tired. If you're tired, given you don't have other reasons. Oftentimes, apnea is a gradual worsening in symptoms. So you don't just wake up one day like you do if you had a cold or other problem, and you're like, I'm tired. It's more like a slow worsening over years and sometimes decades. So I ask patients like, well, when was the last time you slept well? And people think about last weekend or the week before, but in reality, it's something that could have been happened early on. So especially in men have a high prevalence. Men over age of 30 can have as many of them as 20-25% have apnea. So it's really important. So the 4 questions we ask our patients: 1 is, are you snoring? Are you snoring as loud as talking? 2, are you tired for no other reason that you can't explain? O is observed apnea. So if someone next to you notices you stopping or gasping for it, that's a really clear signal. And P is pressure. If you have a history of hypertension, like we mentioned earlier, hypertension is a very common thing. This is sort of so if you have fragmented sleep, it can lead to daytime sleepiness, impaired reaction time. If you don't have a good reaction time, you can lead to driving accidents. But also, if you have repeated stopping and gasping for air that we talked about, that typically leads to increased blood pressure, increased insulin resistance, which then lead to hyperglycemia and worsen your risk for developing atherosclerosis that Dr. Scott was talking about earlier. So it's one more important factor to think about. Quantity of your sleep, which is giving yourself enough chance to fall asleep. We're going to summarize here a little bit some recommendations. So basic takeaways are: best sleep is organic sleep. People often ask me, well, what about this gadget or that gadget? Or what if I had this other basically mattress that cools or heats? Ideally, best sleep is organic sleep. If your room doesn't look like something that looked like 100 or 200 years ago, you're probably doing something wrong, which means keep electronics out of the room. Light disruption, your room should be just as dark. Like if you put your hands in front of your face, it should be dark enough that you can't really see. If you're there's safety risk, fall risk, you want to be mindful of that. And you can have these sensors that move around, motion activated. But ideally, you really want to have a dark, cooler room, meaning in your mid-60s. In fact, it is really helpful for the temperature to change. We are meant to respond to changes in temperature. It improves our metabolism, and in fact, actually, they've done interesting studies. When you keep your thermostat at 70 all year, you're more likely to gain weight than if you didn't. So if you struggle to fall asleep and you're staying asleep for, let's say, an hour or longer, you've done everything on your own, it's best to seek help. The best treatment for insomnia is actually cognitive behavioral therapy, which is more effective long-term than medication. If you snore, obviously, if you do all the parts you're doing, you give yourself enough sleep, you give yourself enough time to sleep, and you still wake up feeling tired and sleepy, then you should probably seek some help. I'm good with time, right? I usually have this for questions, but I think that's probably at the end.